Hi, my name is Hannah and I'm a medic and patient care advisor at MedBelle. I'm here to talk to you about your breast augmentation. My team and I are here to support you through every step of your journey, and we've made this short video to make sure you are fully informed about your upcoming treatment. Cosmetic surgery can be a significant life-changing event, so not only do we want to help you find a fully qualified and experienced surgeon, but we also think it's important for you to understand exactly what's involved. The information we provide in this video is generalized to all patients, and because of this, it's important to recognize that your surgeon is the best person to give you individual advice about surgical techniques, post-operative care, and risk of complications. Nonetheless, having a good understanding of your surgery means that during your consultation, you and your surgeon can focus on talking about what really matters to you. So let's get started. There are a few important factors that will be discussed during your consultation for breast augmentation. Firstly, there are 3 types of implants that are available: saline, silicone gel, and highly cohesive gel implants. Saline implants are composed of a silicone shell that's filled with sterile saline water. They are often inserted into the breast empty and then inflated with saline water through a small valve. This therefore tends to leave a smaller scar than silicone implant insertion. They are, however, more likely to rupture or deflate at an earlier stage, are more prone to wrinkling, and may look and feel less natural than silicone implants. Traditional silicone gel implants are composed of a silicone shell filled with a viscous silicone gel. They are pre-filled before insertion, meaning that they need a slightly larger incision to be inserted, therefore leaving a slightly larger scar than saline implants. They may, however, look and feel more natural as they are much more supple. Although they're less likely to rupture, they can cause more complications when they do. The final implant type, the highly cohesive gel, is a newer type of silicone implant. This is composed of a silicone shell filled with a highly cohesive and firm gel. Their stable structure allows the surgeon to have more control over shaping of the breast, and their supple yet firm consistency helps them look and feel very natural. Of the 3 types of implant, they are the least likely to rupture, but when they do, the contents do not leak out. The aim of a breast augmentation is to increase the size of the breast while creating a natural, attractive shape and appearance. There are many factors that will influence which implant shape is best for you. These include your body type and build, your current breast size, your current breast shape, and finally, the look you're aiming to achieve. Currently, there are 2 implant shapes that are available to choose from: round and teardrop. All implants will add volume to your breasts. Round implants, however, will add volume to both the lower and upper part of the breast. For this reason, round implants can be considered as volume adders. This means if you have naturally beautifully shaped breasts, a round implant can be used to simply accentuate the shape you already have. They also tend to contain more fluid than teardrop implants. This allows them to move the same way a natural breast would, for example when standing up or laying down. It does, however, make them more likely to develop ripples and creases after insertion. Teardrop implants, which can also be called anatomical implants, have a sloped contour that fills out the breast more on the bottom than the top. This mimics the natural shape of breasts. There is a very small chance that the teardrop implant can rotate after insertion, which, due to the shape, may be visibly noticeable. To counteract this, they tend to have a textured surface to help restrict movement of the implant after it's been inserted. If you wish to create a more beautiful shape for your breast, then a teardrop implant may be recommended for you. It is important to be aware that cosmetic surgery is individual to each patient, meaning that what you may need may differ to what another patient needs. As your surgeon is the best person to advise you on exactly which implant type is best for you, discussing your expectations with them will ensure that you're getting the best results for you and your body. There are 3 positions in which your implant can be placed: subglandular, subpectoral, and jaw plane. The decision on which position is best to use is determined by the thickness of your breast tissue and their ability to hide the edges and ripples of the implant. The subglandular position means that the implant is placed over the chest muscle. Implants in this position do not move when the chest muscle is flexed and relaxed. Placing the implant in this position can also help improve the shape of your breasts, as it's closer to the skin surface. As subglandular implants do not interfere with the chest muscle, you may feel a little less tender for the first few days after surgery, in comparison to subpectoral and dual plane positions. The subpectoral position means that the implant is placed underneath the chest muscle. Using this position poses a much lower risk of implant visibility, particularly for thinner patients. This is because the chest muscle provides excellent soft tissue padding over most of the implant surface, which allows them to have a more natural look. It's important to note that an implant positioned underneath the chest muscle is not completely covered by the muscle itself. Usually, the lower lateral side of the implant is left exposed. Implants in the subpectoral position are less likely to interfere with mammograms or cause damage to the milk glands in the breast. Finally, the dual plane position means that the upper part of the implant is placed underneath the muscle and the lower part of the implant is placed directly beneath the breast tissue. This allows the upper edges of the implant to be hidden, the visibility of which can be a problem for slender women. Having the lower part of the implant in direct contact with the breast tissue gives the appearance of a fuller, more curvaceous underboob. These factors mean it is often suitable for slender women with slightly drooping breasts. As this position requires the lower part of the chest muscle to be detached from the chest wall, there is a slight reduction in chest muscle function, but in the majority of patients this is not usually noticeable. The surgical procedure itself will generally last between 60 to 90 minutes. There are typically 3 places in which the incisions can be made: inframammary, periareolar, and transaxillary. An inframammary incision is one that's made underneath the crease of the breast. A periareolar incision is one that's made around the border of the areola at the bottom of the nipple. And finally, the transaxillary incision is one that's made underneath the armpit. The type of incision your surgeon chooses will be individual to you and is something that will be discussed during your consultation. To make this decision, they'll take into account the existing shape and size of your breasts, the implant size, and whether or not you are intending to breastfeed in the future. As breast surgery requires incisions to be made, minimal scarring is unavoidable. In most cases, however, the scars are relatively mild and will become thin and barely visible over time. The size of your scars will depend on your implant type, size, and profile. Although unfortunately scars are unavoidable, there are many scar-reducing techniques that can be found in the post-operative guide, which we will send you prior to your surgery. Your surgeon is the best person to advise you on which type of implant position and incision will work best for you and your breasts. How you prepare for recovery depends on how physically demanding your daily life and work routines are. Your surgeon will advise you specifically about the timeframes for recovery and when you can restart normal daily activities and exercise. But as an estimated generalized guide, we advise the following. If your job includes a lot of physical activity, for example, nursing, waitressing, or caring for young children, then you should plan to take 1 to 2 weeks off work. If you have an office job or a job that does not require a lot of moving or lifting, we recommend taking at least 1 week off work, after which be sensible and listen to your body. If it's telling you that you need more rest, then we recommend you stay at home and put your feet up. If you have young children, then you will need to get your family to pitch in and help out. With regards to exercise, we recommend that in the first 3 weeks you do not exercise at all. In particular, you should avoid strenuous activity and heavy lifting, but even basic aerobic activities might lead to increased swelling. After 3 weeks, you can restart aerobic sports that do not include heavy lifting or excessive movement, for example cycling. After 6 weeks have passed, you should be able to continue all sports and activities. There are a few other points that you should be aware of when preparing for recovery. Your surgeon may recommend that you do not drive for a period of about 5 days to 2 weeks after surgery. This is a safety precaution to ensure that all the anesthetic effects have worn off before you begin driving again. The next point to consider is that you may not be able to shower or have a full bath for the first few days after surgery, depending on your surgeon's instructions. This is because it's important for you to keep your dressings and stitches as dry as possible before they are removed. If your surgeon has used liquid skin adhesive as part of the wound closure process, you may need to keep that area dry for up to 2 weeks. You will also be required to wear a supportive bra day and night for up to 2 weeks after treatment, and nightly for up to 6 weeks. This will help reduce swelling and promote wound healing. After you've gone through your initial recovery phase, your body should have healed enough to allow you to see the full permanent results 6 to 12 months after surgery. As this video and the brochures offer generalized advice given to all patients, we highly emphasize that you should follow the post-operative care that your surgeon recommends. It's important to acknowledge that although your selected treatment is an elective surgery, there are, as with any surgery, risks and complications that you need to be made aware of. The complications that can occur during the surgical procedure include excessive bleeding, blood clot formation, and adverse reactions to the general anesthetic. There are also complications that can occur after surgery. Infections can be quite problematic and have to be taken seriously if they occur. If you are affected, it will become apparent over the first 2 or 3 weeks after surgery. A mild infection, such as a wound infection, will settle down with antibiotics. More widespread infection may mean having to remove or replace the implant. If an implant is removed, it's important to wait between about 3 to 6 months for the effects of the infection to completely resolve before a new implant is inserted. The package price you pay for your breast augmentation will cover the cost of dealing with any infection. Internal bleeding is another potential complication. This usually occurs immediately after the operation, but can very occasionally happen up to 2 weeks later. If there is bleeding present, your breast will become swollen and tight, and you would need to return to the operating room for further surgery. You're likely to spend an extra night in hospital and might be more bruised than expected, but the implant can be kept in place and everything should settle down over time, and it's unlikely to affect your final results. After surgery, it's common to experience some alteration in breast sensation. This usually presents with either an increased or decreased level of sensitivity around the scar and the nipples. In rare cases, if the numbness persists for more than 6 weeks after surgery, it's likely that the altered sensation may become permanent. However, in most cases, numbness and oversensitivity are temporary and will gradually settle down over time. Because implants are quite malleable, they are also at risk of creating creases and folds. The risk of this, however, is very low and is more commonly seen in women with small breasts who choose to have saline implants. The most common long-term complication that is seen with breast implants is capsular contracture. This occurs when your body creates a fibrous scar tissue around the implant, which is a normal physiological reaction to having any foreign object placed inside the body. For most patients, this capsule stays soft and the implant has a bit of room to move around for natural movement. However, in others, the capsule can begin to contract, causing the capsule and the breast to harden. This can occur to differing degrees, but in the most severe cases, the breast becomes very hard and very painful, and the shape is distorted. This, however, can be easily corrected with revision surgery. Another important complication to be aware of is implant rupture. This is when the implant splits open and leaks out its contents. If this occurs, the implant is removed and can be replaced. Implant ruptures can be caused by a number of things, which can include direct damage to the implant, for example during a car accident, damage to the implant before or during surgery which has gone unnoticed by the surgeon, and finally, a rupture may be caused by manufacturing fault or deterioration of the implant shell over time. To reduce the risk of this happening, our surgeons only use the highest grade medical implants that are tested rigorously for quality. Saline implants have a higher risk of rupturing than silicone implants, with highly cohesive gel implants presenting the lowest risk. Although silicone ruptures are less common, they can cause irritation and inflammation around the implant, leading to further complications such as capsular contracture. They may also be harder to detect and can go unnoticed. This is called a silent rupture. It's therefore recommended that you have an MRI scan 3 years after your surgery, and then every 2 years thereafter to help detect any silent ruptures. In any case, the contents of both implants do not present an increase in long-term health risks. Your surgeon will be able to discuss the risk of developing these complications with you in further detail during your consultation. Finally, it's sensible for you to be aware that there's always a risk that you're not satisfied with the aesthetic result of your surgery. For example, you may be unhappy with the size, shape, or symmetry of your implants, and it's for this reason we advise patients to choose their surgeons carefully and make sure that he or she fully understands your expectations and desires. It's also important to be candid with your surgeon about the results that you want. We try our best to help with this by ensuring that your surgeon is a highly experienced BAPS or BAPRAS member. Although uncommon, some women have difficulty breastfeeding after a breast augmentation. On average, there is roughly a 90% chance that you'll still be able to breastfeed, on the assumption that you were able to breastfeed before having surgery. During surgery, there is a risk that the nerves, milk ducts, and milk glands in your breasts can be damaged. Having a periareolar incision around the nipple or having a subglandular implant above the chest muscle will increase the risk of this happening. In most cases, if damage does occur, it will result in your breast producing a reduced amount of milk. In some cases, the breast can stop producing milk altogether, but this is uncommon. If you are worried about producing a reduced amount of milk during a feed, you can increase your milk supply by using a breast pump after each feeding or gently massaging your breasts. These techniques can help increase your milk supply. Many women also worry that the chemicals present in the implants may mix with their breast milk and harm their baby. However, there has been no conclusive evidence to suggest that either saline or silicone implants impact the quality of the breast milk. This means you are safe to breastfeed your baby while you have your implants in place. One of the main concerns patients have regarding implants is the possibility of developing long-term health problems. Although the contents of both saline and silicone implants do not affect your long-term health, having a breast implant in general can increase your risk of developing a very rare type of cancer called breast implant-associated anaplastic large cell lymphoma. This is, however, a poorly understood and extremely rare condition, and if it is detected and treated early enough, it's completely curative with surgery alone. This condition usually presents 6 months or more after surgery in the form of a swollen breast, lump, or capsular contracture. It's therefore particularly important for you to keep a close eye on your breasts and flag up any changes or concerns you have to your doctor. When you go for your breast augmentation consultation, be prepared to discuss the following: why you want a breast augmentation along with your expectations and desired outcome, your medical conditions, allergies, and previous medical treatments, any family history of breast cancer, and the results of any mammograms or biopsies that you have had, and finally, your current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. In order to make sure that you are well prepared for surgery, our partner surgeons would like to promote the following advice: smoking, alcohol, a high BMI, and any form of drug use, whether medicinal or recreational, can increase your risk of developing complications during and after surgery. In order to reduce this risk, our surgeons strongly advise patients to stop smoking and using all nicotine products at least 6 weeks before treatment. Smoking in particular is discouraged as it increases the risk of infection and delays the healing process. It's also worth noting that several homeopathic medications available over the counter and taken for general well-being can negatively affect the outcome of cosmetic surgery. Such medications include, but are not limited to, those containing ginger, ginkgo, garlic, cod liver oil, St. John's wort, aspirin, and several preparations of multivitamins. We therefore advise that all homeopathic medication is stopped 2 weeks before cosmetic surgery to reduce the risk of postoperative bleeding, excessive bruising, and hematoma. After your surgeon has covered your medical history, general health status, and medications, they will then examine and measure your breasts, including detailed measurements of their size, shape, skin quality, and placement of the nipples and areolas, take photographs, discuss your options and recommend a course of treatment, And finally, they will discuss the likely outcomes of surgery and any risks or potential complications. So now, on to what happens next. Essentially, your patient care advisor here at MedBelle will be your main point of contact throughout the whole process. They will schedule a call with you shortly after your consultation, and this is to discuss how the consultation went and to start planning your treatment journey for you. You'll also receive an email from us that details the specifics of what that journey entails. We will of course regularly check in with you during the recovery process, ensuring that you feel fully supported the entire time. If you have any questions regarding any of the information we've provided, please do not hesitate to give us a call so that we can answer them for you. Thank you for listening to this MedBelle pre-consultation video. We wish you the best of luck for your consultation and cannot wait to find out how it went.